I've been studying sexual health since, as I told before, since more or less the last 15 years, so since 2007. So my research has been focused on this, on the risk factors for sexual dysfunction, on the possible psychological and medical risk factors associated. And then when COVID-19 started, I was just looking at the news articles that were published, and a few of these caught my attention. So the first articles that were stating that COVID-19 was largely due to endothelial dysfunction. So the endothelium, for those who do not know, is the inner lining of the vessels of the arteries. So what happens is that once you have erectile endothelial dysfunction, you might have some impaired vascular response. Endothelial dysfunction means that the vessels, including the penile vessels, are not able to stretch, meaning that there is reduced inflow of blood in the penis in this case. So once I had this idea that it was possible that the same endothelial function that was causing problems in the lungs could also have problems in the penis, that's when I started thinking about the possible risks associated for erectile function and COVID-19. So, of course, the first and clearest one, I guess, is what happens from a psychological point of view, meaning that if you think about it, if you are a COVID-19 patient, at least in the first part of the COVID-19 pandemic, you were isolated, people were scared of you, were scared of being close to you, and so on. So the isolation and whatever came together with isolation was a great cause of psychological distress. On top of that, if you think about it, even just the economical situation associated with this, so people that were laid off their jobs, or people that were unable to go see their parents and so on, this also had a heavy psychological burden. So as a first place, I would say that this is something that has also been considered from a more public health scale, I would say. But of course, this is also highly relevant for sexual health. Moving away from this, we can focus on the more medical stuff, I would say. So, as I said before, the endothelial dysfunction, meaning that in fact people usually have this difficulty in stretching the vessels in the penis. So reduced oxygen to the penis means that the erection itself is reduced or impaired, as you would say. And then, once again, if you think about it, we also have some new data on the possible association with testosterone. Testosterone is the main hormone involved in sexual function. We know that the testis is a vulnerable organ for COVID-19. So in the end, there is the chance that people who might develop COVID-19 might also develop what we would call subclinical hypogonadism, meaning that the testis is still working, but it is more stressed to sleep. So it is less reactive, it requires more energy to produce testosterone, and in the end this also means that these subjects, as I said before, developing hypogonadism, also develop all the consequences of hypogonadism itself, meaning erectile dysfunction, increased inflammatory status, and once again even less response to psychological distress. On top of that, we can also say that if we have less oxygen in our lungs, it will become more difficult to have a physical exercise for sexual function. On top of that, as you see, there are so many possible associations. So the drugs that are also involved with treating, as you know, many people develop persistent vascular dysfunction following COVID-19. So these patients might need to have a lifelong treatment with other drugs that can also have negative effects on sexual function. It's never ending, I would say.